like ripping the bib off of him. I'm running him to the table. My life depends on this exam. This is so stressful. Like, this is so stressful. Like,
drop the roof and let the smoke clear. I got diamonds doing just these slides in both ears. Dice rolling on the Las Vegas strip tonight. Slip that on and we might justify.
Good morning. My name is T if you're new here. Thanks so much for watching. I know you guys have highly requested this video. I hope you're having a good week so far. So let's just jump right into it. This video is going to be about my boards exam experience. I'm really only going to focus on my clinical boards exam experience and the prometric, the OSCE, the OSCE. I'm not really going to get into my national boards exam experience because I got into that in another video already. Make sure you check out my dental hygiene playlist to look into all those other videos. And of course, if you have any questions, feel free to comment down below anything you would like to see or like to know. And you are able to email me also if you need to. So let's get right into this video. No long talking. You need to have your clinical boards exam completed, and you have to have your national boards exam. The clinical boards exam is if you're taking the CDCA, the WREB, the verb. So it's the CDCA, the verb, and the CITA. And then other states have the SRTS. Like, there's a whole bunch of different ones. Look into what your state takes and what they will need. But depending on what it is, it's usually a computerized exam. I took the CDCA because I'm in the northern region of the country. So New York, Connecticut, Jersey, PA, all of them at the time, I graduated in 2016, were doing the prometric and the clinical part as technically one exam, but it's broken into two parts. And then you have your national boards exam. So you have technically two exams you have to take in order to become licensed. So yeah, the prometric is the computer part. So the OSCE is about 100 questions, and there are all multiple choice, but they have some blank fill-ins that need the multiple choice answer to go there. And it's basically just based on like oral facial structure, so like tongue, head, neck, areas of the mouth and around. Not so much pathology, but all of that is listed on the CDCA website if you want to look into it. But so yeah, it's just 100 or so questions just based on all of that. So the computerized part, you go take that at a computer simulated place. So it's just like basically these cubicles, and there's test proctors watching you take the test, and there's a computer. You can't bring anything in the room with you. You have a locker, you have a set time and appointment to get there. You make your appointment and you have to get there on time. And each part is just broken up into sections, and when you complete the exam, like the website closes. Like, it's real legit serious stuff. So yeah, so that's what the computerized exam is like. So for my experience with that, I feel like it was pretty easy because my school really prepared us. We did not with this but mock, but we did like a lot of exams that were very similar to that because they were basically like preparing us for the boards. So we did a lot. That was the prometric. It's about 2.5 hours. It's about 100 questions with an intro, the actual test, and a survey at the end. None of the survey and intro don't go towards your grade, but I guess it's just something they wanted to add. So the whole test is about 2.5 hours, 2.5 hours. It's mostly textbook info and just important information that you learn throughout school and clinic and stuff. And you need at least a 75 in order to pass. I don't believe this. I think they give you partial credit, and it's basically pass or fail. So if you fail it, I believe you have like a few weeks to try to get another appointment, and I think the price for it goes up if you fail it the first time. And then the third time, I think if you fail it a third time, then you have to wait like 18 months or something like that. So don't quote me. Go to the CDCA website or whatever your board's exam website is and see about that. You can go to the state of dentistry website for your state that you wanted to do hygiene in. So you just type in like Michigan State of Dentistry and then dental hygiene, and just all the information is gonna be there that you need to do. So there was a lot of questions that we had in school that were used to help us like understand everything, and we did a lot of quizzes in clinic. We did a lot of competencies, and then they would incorporate like the didactic, which is the lecture classes, information into it, so it all ties together. Once you're in clinic, it makes sense. So yeah, so the prometric I feel like was pretty easy now that I look back on it. I feel like I was really confident. I feel like I passed it. Like when I walked out, I felt like I aced it. Like I did not feel like I wasn't confident in it. So my best advice is just to make sure that you're studying, and just getting tutoring programs. There are prometric websites you can go on that will help you with like test prep. There's books. There's so many resources out there that you can use to start studying if you feel like the information you're learning in school isn't preparing you well enough. Unfortunately, yes, we do have to study hard for these, even though we have like so much memorization that we have to have for all these different information that we learn. But you got this. If I did it with all the stuff that I had going on with myself personally, I know you can do it too. So prometric was a breeze. Like it was gonna be a breeze. It was a breeze. It was honestly a breeze. And I got my test results back through email, and it was uploaded on a portal. My test results back probably like I think within a few days, like maybe 7-8 days, business days. It was nerve-wracking waiting for the scores, but I mean, like, I felt confident that I passed, and I just did a good prayer. I had a good sleep the night before. I showed up really early, so there was no way for me to be late. Like, you know, like you just have to be on your stuff. I'm not sure how much the exam was, but I know it was a few $100s. All these exams are a few $100s. And I passed on the first try, so thank you God. So next exam I'm going to talk about is the clinical exam. Excuse if you get noise outside. I don't know what they're doing, but for the clinical exam, the clinical part, I actually did it with a real patient. I know nowadays you can do the clinical part with a mannequin, but I would just advise you to do what you feel works best for you. If you have both options, then choose the option that works best for you. So basically how this exam works is for both exams, they're offered by the same testing provider. So you got to register to take the exams, and your clinical professors and all of that in school are going to prepare you well ahead for this. We started preparing, different schools in different states do the tests like at different times, but my school, they started offering the test around like March 2016. So that last semester, like literally all we did was like starting from October, we started like going through the process of the board's exam and all of that. They walked us through how to log into the website, making sure we had all our information uploaded, because you have to upload like a passport picture of yourself, and then you have to have like a certain amount of credits to even sit for the exam. Like it was a whole lot of stuff. So they started preparing us from October, right? So then when we registered for the exams, we had our I have notes on my phone. We registered for the exams. We needed a passcode in order to like upload our stuff, and it was just like a whole thing. It was like a special code that they give each student, so it's some real legit stuff. So then yeah, so I got my test dates. My school prepared me. We got our payments in like right away, and then I believe you could pay by credit card and all of that on the website or whatever. So anyway, clinical part, yeah, the test was in March. We started preparing in like October. So basically the test has manuals and proctors that we have to go through. So it was really nerve-wracking because most schools do like a mock exam. So I did a mock exam simulation. I think we did one like 2 weeks before we took the real exam, and literally our professors and clinical staff, they basically like created the clinic like how the actual state board clinical exam was going to be. So I already got my nerve jitters out that day, and a lot of hygienists will say that to you, like they got their nerves out that day because yeah, it's mock, it's fake, but they set up the clinic and set up the boards exam literally like exactly how it's gonna be, and they grade you like how as if you were in the real boards exam. So I'm hoping that your school does that for you too, because that would be a really good way to just get all your nerves out. It's good practice for you to take it seriously like it's the real exam, and for you to get all your mistakes out the way so you don't feel like you just started messing up right out the gate, because the whole time, honestly, you know what you're doing, but you're just so nervous that everything is just like extra crazy for you. It just feels like a lot. You have to have multiple requirements to fill out, like a lot of forms, like a lot of forms to fill out, a lot of things to sign. It's like really crazy. But then you have to find a boards patient if you're not going to do it on a mannequin. I didn't have an option to do it on a mannequin at the time. I started taking my tests in 2016, so we didn't have no option to have a mannequin. You had to actually find a boards patient, and I can do a whole separate video on finding a boards patient, but basically the boards patient has certain requirements that they have to have. So like my boy, I didn't live in Connecticut, so I had to go out of my way to find someone who was willing to sit and do the exam. So what most students do, like we had to pay someone to be our boards exam patient, because that boards exam patient needs let me go back for a second. Exam is basically you doing clinical procedure on a patient and doing a scaling and root planing on one quadrant, so about 6 teeth that have light to moderate calculus in that quadrant, and they have a certain amount of calculus is plaque, hard plaque. They have a certain amount of grading system that they go by. You have to make sure you don't like cut the gums. They take off points for that. It's just a whole thing. But you need a quadrant that is visible calculus on the x-ray, but not so much calculus that you can't take it off within that particular amount of time, because if it's too heavy or too hard to take off, tenacious, then you already failed, because if you leave too much calculus behind, that's it, that's instant disqualification. So that's what the boards exam is about. But they're grading you based on how you filled out the forms. They're grading you based on how you are interacting with the patient, because they're watching you the whole time. Doing injections, you have to do local anesthesia on the patient, and then they go behind you after you say you're done, and they take an explorer and they literally check in between every single tooth, and they don't say anything to you at that moment. They just feel around and check to see if you got all the calculus off, and if the gums look decent and healthy, and it doesn't look like you literally like tore them up. You know, they don't want you doing, like, they call it gingival curettage. Like, if you're over there like slicing and dicing people's gums, then yeah, you're gonna get points off, and there's a possibility you can fail based on how many points it is. So I don't know if you drive, but it's just like a driving test. Like, if you hit the curb, that's an automatic fail. That happened to me when I started driving. I failed my driving test on the first try. But anyway, so that's basically what the boards exam is like. So you have to find a boards patient and a few backup patients who fit that, because there can be a possibility you call your patient and they're like, oh, I can't come, like just in case somebody cancels or they don't qualify for it. So you will find this boards patient like months in advance. You do like a boards exam screening on them in the clinic with your professors and everything, and you check their radiographs. You have to check their medical history. If they have any illnesses, they have to have medical clearance from their doctor, signed off by your clinical professor. All of this information has to be sent in before you even seat the patient for the boards exam that day. So it's a lot of preparation. So yeah, like it's a whole lot going on, and you want your patient to have like little to no illnesses. So you wanted to use their family and their friends, but it's like if your family has not seen a dentist in over 5 years and the calculus is on 10, and you know you're not gonna be able to get that off in 45 minutes or like 2 hours, 3 hours, then like they're not the patient for you. Or if your patient has uncontrollable diabetes or some type of illness like a heart murmur or something like that, they used to take that very seriously. Your dad or your grandfather or your uncle may not be a good candidate, so they can come in and be screened to be a boards patient, your family or your friends or whoever, but it's a full process, so you want to have at least like 2 or 3 people that you can practice on. And then when you have a boards patient, they can also be your patient, I believe, afterwards for credit. So you can still finish their scaling and root planing for them on the other parts of their mouth. And just so you know, like, you're going to be spending about 4 to 5 hours with one patient a semester. You don't see one patient an hour like you do out here in the regular dental hygiene streets. So yeah, the morning of was really nerve-wracking. I had a 7 a.m. Time slot. Some people had a 2 p.m. time slot, but I was like, I just want mine in the morning and get it over with. Like I had to get to the clinic by 5 a.m. We had our operatory room set up the day before. Like my unit number, I think, was like number 7 or something like that. So I shared unit number 7 with one other person who was taking theirs at 2 p.m. that day. So they came in at like 12 or whatever time it was and set up for their thing. Or, they had the clinic set up that everybody who's doing the morning, it was set up. So it was set up the day before. We weren't seeing any more patients by this time because we basically was done with clinic. Like, you should be done with clinic. You should be able to see all your patients by then. So the clinic was just set up with just like a whole bunch of plastic everywhere and just like separated tables, and like they set it all up. And then so these proctors that go around the country testing, they come into the clinic and they basically take it over. Like, the professors are there just to help them do what they need to do, but majority of your clinical professors will know them because the same ones come year after year after year and do it. So it's just nerve-wracking because you're not getting tested by your professors, you're getting tested by people you don't even know. So which is a good thing. So it's not like a bias. So if anybody passes, it's because they really did well or whatever the case was. I think out of the 40 something people in my class, I think probably like 34 of us passed on the first try. And there were some people who failed because the calculus was too light. And then there were some people who failed because the calculus was too hard to take off. So it's kind of like a Goldilocks rule. That's what they call it. They want you to have as much like confidence in yourself. And your professor will be like, are you sure you want to have this as your number one priority boards patient? And you have to make that decision, So it's really tough, nerve-wracking, but you're preparing a few months in advance. And yeah, I got my results back. I think I got my results back in like 3 or 4 weeks. So it was kind of nerve-wracking to have to wait that long. Like, I'm like, bro, my life depends on this exam. This is so motherfucking stressful. Like, this is so stressful. Like, it was so stressful trying to get everything together, trying to scrape up the money to take the boards exam. That was another stress in itself. So for me, I was looking for boards patients, and I had to like literally go to like McDonald's around the school and stuff like that, and just like asking students and like screening different people, and I could find no one that like really qualified correctly. So I was stressed. Like, I literally found like 2 people, and then like they kept asking around to other patients who were coming in if they knew anybody. So I finally got like 2 guys. One of them I knew he had like some kind of health issues, but he wouldn't tell me what it was. Girl, he was high, okay? He was high off of something, high off of weed, high off of coke, which you're not supposed to treat patients who you suspect are high. Your boys patients are supposed to be like as healthy as they can be. You got to take their blood pressure and all of that. So T, my patient came in, he was like, girl, I'm high as hell. I'm like, he was like 10 minutes late. It was crazy. So for me, my boys exam experience was stressful. My patient was just a whole mess. Everything on my end was correct, was good. All my paperwork was good. But him being late and him coming in kind of high and having like this nervous energy brought my anxiety up to 10. So I went to one of my professors while I was waiting for him to come because he was 10 minutes late. I just was like trying not to cry. I was trying to like keep it together. And she just calmed me down. She just told me like everything's gonna be okay. And I was just praying. I was just like listening to like soft music. I was trying to just like breathe, you know. So he finally gets there. I see him. He has to go see the proctors first, you know, make sure he doesn't have anything on him that I don't know what they thought, but like cheat with or anything like that. So they go and check on him. He comes, he sits down, and he's like, girl, I'm high. I'm like, don't say nothing. Sit down. And mind you, I met this man probably like 2 or 3 times. So I don't know him like that. He's not my friend. I'm paying him to do this exam. I paid him like $100. So it's like I gave him, I think, like $40 up front, and then the rest he was gonna get that day after he showed up. Girl, while he came high as fuck, I took his blood pressure. Blood pressure was like a little elevated, but like it wasn't that bad. And I was just like, please, like, act normal. Just act normal. Like, don't be weird, because if they sense that you're high, I have to disqualify you as a patient, and like it's gonna be some shit. Like, I feel like I could tell this story now because I'm licensed now. So now he's like singing, he's like doing all of these things while I'm trying to do his local anesthesia. And mind you, I've only injected him only on 1 quadrant right here. So the mouth is into 4 quadrants, right? So you have 1, 2, 3, 4, right? He's stressing out, he's going crazy. So I'm like, stop, like, sit there. So I'm doing to him, and so finally I get him his blood pressure taken or whatever, get him injections done or whatever, and now I start doing his the cleaning on that one section, and he's like, I can still feel it. So now I have to call somebody over to watch me do the local anesthesia again and make sure that everything is good. They only watch you for like maybe 30 or 40 seconds. They know you can do it, so whatever. Literally had to inject him again, so that took time. I'm nervous, I'm stressed, I'm like sweating, like so finally get him to a comfortable place, and I was just like, sir, please, like, I can get this calculus off in the next like hour, so if you would just chill out, just breathe, just chill out, right? So I'm trying to calm him down, trying to calm myself down. Finally, it got to a point where I felt good. You know, meanwhile you're doing all of this, there's proctors walking around watching you the whole time. Some of them will just stop and stand and just watch you. Like, it just was like, I was losing it. I think I was almost done or whatever, but then he stopped and he had to go to the bathroom. So I had like literally like 30 minutes left, and he had to stop and go to the bathroom. It stressed me out because I wasn't done. So he went to the restroom or whatever. I feel like he went to the bathroom. To go do, you know. So he came back acting weird. I was like, oh my god, this is the worst I could ever do in my life, like whatever. So he comes back and he sits down, and I literally have like, I was trying to like be a perfectionist and just like keep checking and cleaning and checking and cleaning and checking, and literally it got to like 5 minutes left and I'm still in the chair polishing him. I'm still like doing everything, and they're like, my professor came over to me and was like just acting like, you know, she was getting something, and just was like, T, you need to hurry up, like you have to finish. Like, I know you want to be perfect, but you need to finish. Like, you cannot be sitting here dealing with this man. Like, I'm like, I know he's stressing me out. She was just like, whatever's not done but it's done, babe. Like, you got this. Like, it's done. Like, you need to get up now. Like, he needs to be over by the table in the next 3 minutes. Like, he should be up and out the chair. My dumb ass, they're like almost done. They're like 40 seconds, and I'm like ripping the bib off of him. I'm running him to the table. Mind you, I gotta have like all my files and forms and papers and all of this stuff together. He has to look clean and neat. He can't have blood on him. He can't be wearing a bib. Like, I was running. Literally, I had 40 seconds left before it was over for me, right? So literally, I went and I dropped him to the table so they could check him or whatever. So I walk him over, and they have a part over on their side where they do a final check, and then they start doing their grading system over there. And at that point, over there getting graded, the test is over. All of my all the people that were in my clinic with me at that time were just like hugging each other, crying, congratulating each other, explaining their experiences. You know, we're all like leaving, going to go change out of our scrubs and everything. And my professor came over to me that I was really cool with at the time, and she was just like, you scared the crap out of me. Like, don't ever do that again. Like, why would you wait so long? And I was just like, I don't know. She was like, girl, I thought I had 40 seconds. She was like, you literally have 15 seconds or you was gonna get disqualified. Like, why would you do that? And I was like, oh my God. Like, I could have really failed just off the strength of not having him over to the chair in the time. Like, it was so nerve-wracking. So finally got like done with everything, changed my clothes, and I went over to one of my friends' dorms or whatever. And I think I was just chilling in my bed, like just trying to relax, just like losing it, but like trying to relax, and just was like, fuck it, like it is what it is type shit. And I think I had got some food and like got some drinks, because I was like, I need a glass of wine, I need something to get through this, because whoo, I was like celebrating basically, like this, like it's over. Like, I did my program, my computer part, I did the clinical part, I'm gonna do my national soon. Like, I was just like, I felt like I was done. Like, I didn't graduate yet, but I felt like I was done, like done with it, you know. So that was my boys experience. Obviously I passed on the first try, thank you God. Ended up just like finishing, and everything was a vibe. So just focus on listening to them. I think I got my results back in like 5 weeks. And then for the national boards exam, I think I got my results back in like 3 weeks. So it really just depends. Some people got them back earlier than me. Some people got them back later than me. I don't really know. But one of my clinical professors told me on the low though. She wasn't supposed to, but she told me on the low. She was like, you passed, girl. Like, I know you passed. And I was like, what? She was like, you passed. I was like, but she couldn't confirm that for me. But she was just like, I know you passed. They were like really happy with you. And I was like, purr. Thank you so much for watching this whole video. If you got to the end, I know that it's really hard to like think about this process and not like be stressed out, but you got this. Please, if you study and you focus on what you need to focus on, you'll be fine. But yeah, I really hope you guys enjoy the rest of your day. And thanks so much for watching. Make sure you like, comment, and subscribe. Follow me on TikTok, follow me on here, Instagram. I'm gonna be more consistent. And yeah, bye.